Hey, welcome to the GoToPhysio podcast. We are on episode 71 or season 4, episode 21 of building a go-to clinic that gives you true freedom. And what today's episode is all about is how to naturally increase your therapist reviews and referrals. So today I'm not going to go into a lot of the systems and the structures of when to ask reviews and all of that. But what I want to focus on in today's episode is how to have this happen naturally for you, okay? Because the reality is most patients, they're going to want to do this naturally and they're going to want to feel so good that they want to give something back. And if we can focus on keeping the main thing to make sure that that's happening, then we're not going to have to resort to all of the other things like having to physically ask patients. So I'm not saying there's nothing wrong with asking for reviews and referrals, but what we want to get focused on first and fix is actually how do we make this happen on autopilot for the vast majority of patients. And in order to do that, we go back to our structures of systems. I want to revisit our value definition. So the big thing that we want to look at with value is understanding the difference between perceived and actual value. And if you're not getting reviews and referrals, or your therapists aren't generating enough reviews and referrals, then there's a high chance that there's a misalignment in what I'm about to go through next. So perceived value is the expectations that the patient has from our solution or our treatment plan. So they're expecting something in return for their time, their effort, their money, okay? And then actual value is only ever created when the expectation matches the solution, okay? So essentially, whether we like it or not, no value has been delivered in the eyes of the patient until they get what they were expecting. And that can be a hard thing to get your head around, because clinically on the bed, we can see they're making progress. But if the patient doesn't perceive that value, then essentially no value is being delivered. And that's the harsh truth. And that's our responsibility as clinicians to understand how the patient perceives value and then go and deliver it. So if we want to look at this from a reviews and referrals point of view, then all of a sudden it's actually not that complicated, because raving fans and reviews and referrals, they're created when our solution or our treatment plan exceeds the expectation of the patient. So if you want to get more reviews and referrals, then the problem to be solved, the true problem to be solved, is that the treatment plan needs to exceed the expectations of the patient. So we can simplify all of this down then into a 5-step process, where step 1 then therefore is we need to know very clearly what the expectations of the patient is. And that all happens in a subjective assessment. So using the head physio systems, we can go into the patient notes, the therapist notes for the patient, and we can audit that to see, okay, is there a clear documentation of how the patient defines value? Okay, and then we want to find all of the other pieces along the way to achieving that ultimate expectation for the patient. And they're what we would call in the go-to clinic mastermind and therapist mentorship is patient-defined value outcomes. So we've got our definition of success, which is like the long-term goal, okay, or the number one goal that the patient wants to get back to. But then we also have all of these other patient-defined value outcomes along the way. So usually these are the things that the patient needs to be able to do and wants to be able to do on a daily basis. And these are the things that the patient is coming to us for help with. They're not coming to strengthen a muscle or to improve their range of motion. They're coming to be able to do things in their daily life. And I think that's the big misalignment very often, is the treatment plan is misaligned with the patient-defined value outcomes. That's the whole reason we've created the Go-To Clinic Hub, essentially, is to make sure that the treatment plan is aligned with the patient-defined value outcomes. So step 3 then, once we understand what the patient's expecting and how they define value, then stage 3 is we need to use our objective assessment to actually analyse how to give the patient the outcomes or give them those perceived values. So all of a sudden, this isn't that complicated. So if we're not generating reviews and referrals, then step 1 and step 2, we want to go back, we want to audit our subjective assessment notes. Okay, how clear is your therapist on defining value for your patient? Then step 3, objective assessment. What were they looking in the objective assessment? Because that's what I would be looking at here if I had a therapist that wasn't generating reviews and referrals. So again, are they just going through the generic objective assessments, or are they actually assessing what the patient has told them in the subjective assessment of how they define value? And then step 4 is we want to set expectations for the patient. And that's what we would call in the mentorship effective explanation. Okay, so we want the patient to understand what we want them to understand, that our explanation is effective. So again, if it's going to take a little bit of time, then we need to set expectations to give us the time in order to deliver the value. And again, this isn't about you trying to be a miracle worker. And if this is going to take 5, 6, 7 sessions, then we have to set expectations in that first session to allow us the time to generate the reviews and the referrals. And very often that can be the big issue, where actually your therapist is doing a good subjective assessment, they're doing a decent objective assessment, but they don't set expectations for the patient. And then what happens is usually 2 or 3 sessions in, the pain sees in, the patient drops off. So very often, to get the reviews and the referrals, remember what has to happen. We have to exceed expectations. In order to exceed expectations, we need time. In order to have that time to deliver and exceed the expectations, we have to set expectations in the very, very first session, in the initial assessment. So we set the expectations, and then we go to work and we make sure then that our treatment plan is aligned with how the patient defines value. So that's then where I'm looking at the notes and actually where did the therapist start with the treatment. Okay, and again, I use this classic example with one of our therapists where the patient defined value outcome is, I want to be able to sit for six hours a day. Okay. I want to be able to drive from Leeds to Sheffield and not be in pain. Okay, and again, when I ordered the notes, a lot of the treatment was around the hamstring and giving the patient better posterior knee stability. Now, clinically reasoning, the therapist isn't wrong there in terms of helping undo some of these issues that may be contributing to the low back. But the big thing that didn't happen in that first session is we didn't align the treatment plan in the first session to help the patient feel the difference and feel the value in those first couple of sessions. And that's where we want to get the treatment plan aligned. And this is where we have to juggle it as private practice clinicians is, okay, we need to address the root cause, but we need to set the patient, up for success in the coming week ahead. Okay, and there's plenty of ways we can do that using top-down cues and intention and other bits and pieces as well to help the patient be successful and change their pain experience. Because remember, it's not that hard to change pain. Okay, like it really isn't. Let's be completely honest here. We can use a distraction technique to change pain. We can use a painkiller to change pain. The hard part is keeping the pain away. And that's where we just need to understand what influences pain and then how can we use that to our advantage. And that's where we have to go back to principles. Okay, so these are the key things that if your therapist isn't generating reviews and referrals, the action items are they clearly understanding the expectations of the patient? How you're going to do as a clinician, you can either assess them directly or you can audit their notes. Do they have the milestones down on the subjective assessment of how the patient defines value? Is the objective assessment then just generic? Okay, and it's very clinical based, or are we actually assessing? So again, if the patient wants to go up and down the stairs, if they want to get up and down off the chair, if they want to sit pain-free for 6 hours, have we actually assessed how the patient is sitting? Okay, and again, these are all common sense things, but you'll be amazed that some of this stuff isn't happening. Okay, then have we set expectations, and then is the treatment plan actually aligned to it? Okay, and again, the 6 stages to consistent reviews and referrals, just as a quick reminder, we've done a whole episode on this. Okay, step 1, the patient has to buy into the treatment plan. So that's where we're going mapping out. Here's where you are. Here's what you want to get back to that you've told us you expect. And then here's all your patient-defined value outcomes along the way. Okay? Here's the problem. Here's why it happened. Here's the plan. Here's how many sessions it's going to take. So we've set expectations. Then they feel the difference in the first session. So we've aligned our treatment then to these patient-defined value outcomes. And that's why we've built the Go-To Clinic Hub, is to help clinicians and clinic owners make sure the therapists have everything they need to actually align the treatment plan with the patient-defined value outcomes. And then the patient stage 3, they rebook and they attend the second session. And again, the rehab that we prescribe in the first session is going to dictate if the patient continues to receive value between the first and second session. So again, with my particular therapist there with that story, where they're giving them a load of exercises to do that there's no dynamic correspondence to sitting pain-free. Okay, so there's a mismatch in the therapist reasoning and how the patient defined value. So we want to make sure that what we're prescribing between the first and second session, the patient can continue to feel that progress. Then we want to hit those first 3 milestones, which is the first 3 patient-defined value outcomes within the first 3 sessions, ideally. Okay, because again, if we're not hitting any of these outcomes, then we're not making progress in terms of the patient's perception of perceived value. Okay, so this isn't rocket science, honestly. It's just common sense, actually, and just need someone very often just to show it to you. So if we're not hitting the first 3 milestones within the first 3 sessions, of course that patient's at a higher risk, okay, because they feel like they're not making progress. Okay, so they're the patients then that we want to be flagging and then discussing in our in-service trainings, rather than just assessing a knee, is let's use the in-service trainings to actually, number 1, upskill our therapists, but number 2, prevent these patients from dropping off in the first place and not have to rely on our admin team then to try get the patient to come back in again when actually there was a problem with the treatment and the value creation in the first place. And then step 5, which is a critical component then, assuming we've done the first 4, then is the patient keeps progressing even when the pain is easing. And that's the value of the patient-defined value outcomes, is they can see clearly in black and white, they requested to be able to do these things and they know in no uncertain terms that they haven't yet achieved some of these outcomes. And that's the beauty of the GoToTherapist mentorship system, is that actually what we do in the subjective assessment is we just get the patient to tell us the treatment plan, okay? All our job as clinicians then is to map it out in graded exposure and then fill in the gaps if there's a bit of a too big a jump in graded exposure. If it's not safe to go from C to E, then we have to put in D, and we have to explain that in the context of the patient's life and how it's going to add value and why they need to do it. Okay? But very often then it's that stage 5, usually around that session 4 to 6, we get that right. That's where you'll see your therapist PVAs improve, but you'll also see your reviews and your referrals improve because we've got that time now to make the significant difference. And then stage 6 is they're exposed to the worst case scenario and they're moving with that thoughtless, fearless movement. And being exposed to those worst case scenarios, there's a lot of psychology in that, okay? The patient's fearful at the start, they come out the other end and there's a massive change in how they feel. Their confidence increases. When their confidence increases, they feel different. When they're feeling different, guess what they're going to do? They're going to be at that prime position to leave a review because they're so happy. And ultimately, customer experience is a feeling, okay? And stage 5 and stage 6 is where we can really change these feelings throughout their day, where they can notice the difference. And that's really, really important to understand, is customer experience is a feeling. And stage 5 and stage 6 of the customer journey is where the feelings change. They go into it feeling fearful, they come out of it with a different emotion because now they've got confidence, they've got resilience, they feel resilient, and we've built that robustness as well. So that's your 6 stages of the patient journey. If your therapist isn't generating enough reviews or referrals, or you're not, then have a look at the 6 stages, which are the stages that you need to work on most. But the easiest thing to do is to realign your subjective assessment in terms of how the patient defines value. And then a lot of the time with this stuff, mentoring more than 1,000 plus therapists now, but also week in, week out here in our own clinic, looking at the patient numbers, looking at the physio numbers, and looking if there is any drop-offs or cancellations or anything like that, and auditing the notes. 99 times out of 100, it's actually a focus problem. Once you get the clinical skills in, it's a focus problem. Okay? So that's it for this week. Thank you, as always. If you want some help with this, the GoToTherapist mentorship, the GoToClinic mentorship, depending on where you are in your journey, if you're working for someone else in private practice, the GoToTherapist mentorship may be a good option for you. If you have your own clinic, the GoToClinic mentorship is there. We've got 2 options for that. We've got solo clinic owners and we've got multi-therapist clinic owners, where your therapist can have access to our therapist mentorship and you can have access to all the tools that you need, everything you need ultimately to build a GoToClinic. So that's it for this week. Thank you as always for listening. I'll see you next week. Thanks for tuning in to this week's show. I hope you enjoyed it. Now, if you'd like a free copy of my Head Physio Systems 6-step checklist that I use to personally audit my own therapists to make sure that they can keep patients progressing even when the pain is eased, so that we can ethically increase our patient numbers, our revenues and referrals, head over to www.thegotophysio.com/checklist and I'll get that sent straight over to you.
That's it for this week. I'll see you in next week's show.